know. I don't understand. Yeah, so they just don't want to hurt anyone's feelings. Maybe they get a discount at the business.
Yeah. And, it's just also just kind of contradictory is the fact that the Division of Environmental Health, the inspectors, they go out and they inspect all these facilities for COVID-19 and also for sanitation inspections. And yet they release the names of these businesses. They release the violations that they found at their establishments. So I just don't understand. I mean, if we're all talking about, fighting COVID, arming yourself with knowledge, it's like you would think that would be something they would do and let us know.
Yeah, and I think in this specific case, what also might be hindering the business coming out publicly is that it's a national chain, and they've got a whole corporate structure. You know how it is. They can't even say hi to us without running it through 5 different corporate offices in the States. So that's part of it. But I think at this point, everybody knows what retail business it is. Mm-hmm. I mean, you're seeing it in the comments. People were messaging me last night. Yeah, so and let's bring on Dr. Hoa from the Physicians Advisory Group. We'll just start with this, Dr. Nguyen. I know that you don't agree with public health not naming the business. Good morning.
Hi, good morning, guys. I think there's certain things you have to look at, so if a business just have 1 or 2 person positive and you do the tracing and it's come back to the family, then it's not a really huge problem. But when a business have a lot of positive employee and there's a high possibility that the spread is within the workplace, especially if you are a place where you provide service and retail for the customer, definitely they should be disclosed to the public, just because the public frequent those places. So I think at a certain point, it's not a HIPAA. HIPAA is a personal information. Okay. So, for the public, they should be able to name the business to make sure that, when people go there, they have to take caution when they go there. And that's my opinion as a physician. Yeah. But there's nothing wrong with disclosing business. But if a business, I would step up because you are doing your business in community, and it's helpful for a community to know.
Right. And how many doc positives at a specific business would be of concern? 1 or 5?
It's not.
6.
It's not the number, Sabrina. It's basically, contact tracing, and within the business or by public health would know that, hey, the positive case come from the home, or it come from the place of employment. And the biggest part on the business side is that I would highly encourage all the business to take a look at the way the employer, kind of interact within each other. Especially during lunchtime. That's where I think that when you eat lunch at your workplace, you drop your mask, and that's where the possibility of the spread the virus occurs. So I would encourage all the employer to kind of take a look at that setting and basically take precaution and take some measurements, something to try to prevent that.
Yeah, I want to
there's a breakdown in the.
I want to read from Nestor Lecanto's story here. Public health spokesperson Janela Carrera said if public health believes there's the threat of the potential spread of COVID-19, it will step in and investigate. If there are positive cases, the establishment is required to cease operations, wait for 24 hours, and then thoroughly disinfect the premises before it reopens. Many local companies and government agencies who've had positive cases within their workforce have voluntarily announced their closings and reopenings for the safety of their customers and the employees. However, Carrera says a business doesn't need public health clearance to reopen once it's completed disinfection. And I'm just going to go ahead and say it, Doc, because it was confirmed through employees of this business that the 41-year-old fatality yesterday morning was actually an employee of this business. So what I think is key when you talk about contact tracing, one other reason that the public should know which establishments are having a few positive employees is so that people out here who went there or who know people who work there can understand and know, like, oh my, okay, so I had a contact with somebody who worked at that place. Let me go call. Let me monitor myself, or else we're just flying blind.
Yeah, it's true, and that's what it's truly, like I say, it's just not the number of positive in the workplace. It's how you do the contact tracing, identify, hey, originate in the workplace, or you take it from home, and it's important to know the difference, and you have to know the difference. So it takes several days already, so public health should know, and I think that sooner or later they have to come out and name the business somehow. It's a protection of the community.
Is this something that the Physicians Advisory Group has discussed and if not, can discuss and make recommendations to the governor? Because at the end of the day, she has the final say.
PAC is an advisory group. We don't make policy for public health or have any enforcement of public health. We just look at the whole situation, discuss within each other, and make recommendation. And it's really up to public health and other government agency to follow or not. We just, as a physician group, we look at it and we say, hey, this is it's not good. You got to change something. But it's really, we have no enforcement over the agency. So
right, no, I understand that. But is this a recommendation, though, that the Physicians Advisory Group would give to the governor, who is the public health authority and has the final say?
Yeah, we would advise them to, on this case, especially, that the positive come from the workplace. We would recommend that, hey, you need to identify it and you need to name it. The public have to know. I wouldn't feel comfortable walking in a place that I don't know nothing about, and that's it's kind of stem out the rumors and people on. That's the biggest part. Is we live in the age where this thing can spread in the Wi-Fi and that look bad for your business. So I think for the safety of everybody, you should come up and say something.
Well, Doc, do you know what business it was?
We identify some positives in the business, but now public health have the big number, right? I can see in my clinic 1 or 2, but other clinic also see 1 or 2 also. So when you add up a whole bunch, when we talk to your patient, it's in kind of possibly discern business. But like I say, when public health have a big number because they tally everybody and they know where they are, so they should know exactly where. It's on the net. You say, I not say that's the right place, but just like what I read on the internet, I know the 41-year-old person that passed away from Kmart, but that's a place where I'm not sure. I say they have to step up, or public health to have to name them. But
so wait, Doc, let's go back here. Did you confirm that the 41-year-old fatality was a Kmart employee?
Yeah, that's what I read on the net yesterday. But I said, but that's have to be clarified by the agency that have to total number. When you do contact tracing, it's just like when we do in the clinic. We ask the first question: where do you work? When the last time you worked? Because that kind of help us narrow down to, what else we have to test in that business, and so we advise the person that's positive, hey, go back 4 or 5 days, tell your employer they need to trace back 4 or 5 days. So we ask this question in the clinic in order to help the employee that turn positive, to advise the employer of how to do the contact tracing in their own workplace.
Yeah, I wonder if this business shut down for 24 hours, like Janella said they were supposed to, and disinfect the location. Do you know if that happened, Doc?
It's not a requirement, guys, for a business to shut down 24 hours. They do that precautionary to make sure that everything get desanitized and get ready for the customer to come back in. But I don't think it's a public health law that you have to shut down to do that. But like I said, depend on what type of retail store, what type of service store that you have. That's you make the determination by the management, and that's why most of the workplace kind of decide to shut down to desanitizing because it make the customer feel more comfortable.
So was it Kmart?
That's what I read in the newspaper. Like I said, either Kmart or any other business that on the list there that step up and do and announce themselves, or public health have to do it. They name on the business that the active duty frequent in the past. So I know that they get some heat on name of the business, but at some point, the church did it, some church did it, some other place did it. So I think you live in a community, you provide a service community, it's time to let the community know because, you.
Yeah, I mean, it is really just disingenuous when you see PSAs like "I protect you, you protect me, I respect you, you respect me."
But we protect the business when it got a lot of positive.
Yeah. That's a lot of change, and like I said, we pushing hard on the pack and advise to be release more number, so that way the business know. And also for everyone else to make decisions. It's important. And as we move forward, like I say, we're not going backward. I know there's positive case going up, but we really have to move forward and really ask everyone in the community to really, just like you say, respect each other. And protect each other. Because if we let our guard down, this number is going to go up. And it's going to hurt everybody, hurt the economy, hurt everyone. So, again, I talked briefly last night that the biggest number one positive right now is the family gathering. And this virus here really take advantage of our culture. Our culture is family gathering. And I tell you, so many cases that we see the family say, oh boy, we make a big mistake. And, in order for us to kind of make this positive rate go down, is for all the family to not visit each other for about 2 weeks. You don't have to lock down. You just stay home and keep within your household for 2 weeks. And I tell you, this number will go down. Because that's all we hear about is we visit each other, we have a gathering, and now every family going to turn positive. And that's a number one positivity rate is in the family at this point.
Right. Doc, I want to just go back again because I know that we were the only media to report it, but the possible spread among employees at a well-known business, can you confirm that business is Kmart? Yes or no?
Just like I say, we read about it, and there's high possibility, but the public health have the number. They can tell you yes or no. But to me, the only thing I can tell you is that what I see, but I don't have the final number. There's a lot of business that have positive in the business. Kmart not the only one. So there's multiple business, and that's why I've asked the business employer to really look at how the employee interact with each other during the work days.
Right.
It's not the only one, guys. It's not. And again, I would fix it say number two positivity right now after the family gathering is a business. We come to cycle and we see, within our practice, hey, there's certain group and certain thing that go up, and so family gathering number one, business is number two. So the business really need to take a look within their workplace.
We had a comment here, Doc, from Guam Seller. Cases are everywhere. Rather than name a business, just act and assume that it is everywhere and protect yourself as if you could get it.
100%, and that person is correct. You have to act like everyone else around you is positive, and at this point, that's the only way we protect this thing, because the only way we can give it to each other and when that mask is off. When your mask come off, and within 5, 10, 15 minutes, you might have to pick up somebody that sit next to you. So, if you pretend like the person that sit next to you is positive, then you will always have that mask, or you social distance yourself if you're going to take your mask off. And that person is correct, pretend like the person next to you is positive. But unfortunately, sometimes during the normal daily activity, we tend to forget that. And it only takes a few minutes for us to pick up the virus. I can't see it. And some people have very mild symptoms, and that's a problem. And the business place, I tell you, the reason it come up in the business because people are going to work when they're sick, and frustrated to see that, but people still go to work because they're sick. So the employer needs to kind of be relaxed on the sick policy in the workplace. So because people, they go to work because they need money. That's the thing, and that's, if you're the only breadwinner of the family and they have to go to work, they will go to work if they feel just like a little bit of congestion. But but they have to go to work. So the business have to, I don't know, it's hard for me to say, but they have to kind of relax the sick policy somehow to allow people to stay home.
Right. Doc, 58, the latest numbers, 58 COVID-related deaths, 66 positive last night. 2,934 people have been infected with COVID, 810 active, 2,000 recovered, 47 COVID patients hospitalized at GMH, 13 receiving ICU level of care there, 3 people hospitalized at Naval Hospital, and 2 in ICU last night. What did you guys discuss last night during your PAG meeting?
Again, we discussed of how to move forward in this. It's impossible to go back on lockdown. It's really impossible. I mean, that's not a good option at this point. And we really plead with the community and the family to really respect each other. And just 2 weeks, that's all we need. Is you can go to work, you can go home, but don't visit each other for 2 weeks.
So go ahead.
And the possibility that we will see the number go down. Don't visit your relative. Just 2 weeks. That's all we need. And because, people stay away for so long now that they miss each other, and they want to visit each other. And the problem is right now it's not the right time. So we're just going to ask everybody to kind of hunker down for 2 weeks, go to work, go home, and stay within your household. And, the number of hospitalization will go up.
Yes.
Going to lag behind about 2 weeks, but it will continue to go up. And
so you saying that we're going to see a complete lockdown for 2 weeks? Is that kind of what you guys are leaning on?
No, not the complete lockdown. We're not going backwards.
Okay.
We're not.
So what are you saying?
Okay. The family unit have to stay within the family for the next 2 weeks. That's what I mean. You can go to work, you go home, but don't visit your mother. Don't visit your sister. Don't visit your brother. Just stay within your house for 2 weeks. That's what I mean. I mean, respect each other, because you don't want to, inform your family that, hey, I'm sorry, but I'm testing positive. Now the other family in the other household, they're all going to be test positive. So stay in your household for 2 weeks. That's what I mean, Sabrina.
Is that like gonna be through an executive order, or it's just a recommendation by the PAG to the governor, or it's just a recommendation you're making to the community on the show?
It cannot be an order. It's through you guys. It's a very good public service, and through the newspaper, through the media, through the Facebook, whatever we need to do to try to ask people, stay with your household for 2 weeks and try not to visit each other. But we have Thanksgiving coming up. And you have Halloween, all kind of stuff. Every time that we think we get over the hump, there's a holiday coming up, and we're back to square one again.
So what was the primary discussion during the PAG meeting last night?
That's one, that we're not going backward. And, we had to kind of do a lot more target testing on certain subgroup. And then, they're building up a rapid response team that will try to go out there and kind of isolate the positive really, really quick in order for them to not spread out. Because you understand, if you have one positive in the family, the rest of the family have to be isolated, contact right away so they can stay home. But if you have one positive family and the other family member is still going to work, there's potential they're going to spread out the virus to the workplace because you have a positive in the family. So, but that process had to be very quick. That's the only way that we can make sure that the virus contained within that family only and not get spread to other people around you or the other business. The rapid response team is, we got to put that thing together really quick.
Yeah. Doc, we had public health. I just got to say, though, we really tried to get public health on this morning because I believe that with the high number of positives, the high number of deaths, the high testing positivity rate, we're in the middle of a public health emergency. I feel like public health needs to have more of a and they do. They come on every Friday, but for some reason this week, we got Tuesday, Janella and Mrs. Tyron to talk about the quarantine, but we haven't had anybody from public health come out and say, hey, this is where these positives are coming from. This is who we did the target testing on. And I feel like it just look at us. Look at what we're talking about. People are freaking out now because there's no word from the public health authority. And so we had them on. We talk about contact tracing. I got a friend who had messaged me regarding your contact tracing discussion this morning. They had an employee that tested positive, and he was contacted by public health 8 days later. And this is not an isolated statement. I mean, I'm hearing that although in the oversight they said that, they actually do contact tracing and they do it well, which I'm pretty sure may be the case sometimes. The ones I hear about are people who test positive and they don't hear from public health until like a week later or more.
Yeah, that's something we agree. There's a lot of room for improvement, and in order for us to contain this thing, and like I said, we're not moving backward, we're moving forward. But in order for us to move forward, and we're gonna cut down this thing, the number one thing that we have to have is the isolation and the contact tracing as the number one key. I put all my money, all my basket on that, on those two teams. Right now, I tell you, there's no limit on the amount of fun and the amount of people that need to pull into those two, because that's the key for us to go forward successfully, is to be able to contain this. You really can't get rid of it. You cannot. but you can contain it effectively if you do the isolation and the contact tracing to surveillance team do the right thing. So we continue to advise them to really put a huge amount of effort in this one. We just look at Hawaii. They completely revamped the public health. They replaced everyone in the public health in Hawaii just to because and they have the same thing like Guam. They have problem with the transparency to report the number, and the contact tracing. And Hawaii is a much bigger population than we are. So if we can, we are 160,000 people. So if we fix ourselves when we do the right things, I think that we be okay. It's just, but it's not just a public health problem. It's the whole island. We really need, as community, everyone to follow the rule, and we will be okay if we do that.
Right. Doc, earlier in the week I got a question from someone who messaged me on Facebook, and it was about the medicine that doctors are using to prescribe to COVID-19 patients. Can you tell us what exactly are patients here in Guam being prescribed for COVID?
The medication to treat COVID is strictly on through the IV at this point, and that's only can be admitted in the hospital. It cannot be used in any type of acute care clinic like AMC, FHP, or a big clinic. It had to be in the hospital only. The cost that people kind of take and I know that there's a push on let people know of what vitamins, what supplement that people can take. President Trump on all of them, and I think that's as soon as that thing people know about it. Probably you don't have anything on the shelf at any store in Guam if people at home buying this stuff. But vitamin C, vitamin D, melatonin, Tacamid, aspirin, and zinc, and those are stuff that people can take to boost their immune system. Like I say, and that's all you can do at this point. There's no outpatient treatment for COVID-19 that really, really effective. You have the influenza. I can give you Tamiflu, and you get better in a few days. But the problem with COVID-19 is there's no effective antiviral medication it can give to you as an outpatient.
But do you know?
And there's no antibiotic need. So it's a virus. Antibiotic doesn't work. A lot of patients request, Zitromax or anything for antibiotic for when the COVID-19, and it's wasteful. It's not going to help you.
So basically, you're saying, Doc, that the medicines that they use to treat COVID-19 that we might hear about nationally are only given in the hospital setting once you've been hospitalized.
Yeah, only in the hospital. That is not giving anywhere else. I can give IV Rosef in the clinic for antibiotic-wise. I cannot give that in on the outpatient setting, and it's not approved. It had to be monitored. So.
So what was the medicine? I'm sorry.
So which medicines do they use in the hospital setting, Doc?
I think the remdesivir or something like that. That's in the
remdesivir.
That only used in the
remdesivir.
Yeah.
That's
the only one that can use in the hospital. That's the only one they can give. And I know President have a new, a treatment that is not widely used. Only a few people have it because it's still under study.
It was like a stem cell treatment or something I read.
That's an experimental drug, and you can't have everywhere.
So that's what they're using at GMH, remdesivir.
Yeah.
And do you know? Do you guys have discussions on whether or not they're like stockpiling up on that?
I think that they're not short of that.
Okay.
So everyone come in there have multiple doses. You have to treat them at the beginning, and then after a certain point, when the virus is not there no more, you have to worry about the anti-inflammatory effect of the virus. So, it's a different treatment after about 5-7 days or so. It's a totally different treatment because you deal with the inflammation caused by the virus. So,
We had interviewed a woman last night. Adriana Cotero did a story about her mother and father had tested positive. I think it was back in August. I believe it was in August, and they had recovered, but they still test positive for.
Yeah, I know. I'm about to find out who's the person that I can reach out and talk to them. It's a very simple decision. I mean, once you test for the PCR positive for the COVID-19, you follow the symptom. After about 10 days or 2 weeks or so, your symptoms should go away completely. And you don't retest them. You don't retest them till 3 months from now. But if you retest the person and they become positive, it doesn't mean they're infectious to anyone. You're still going to pick up the viral particle up to 3 months. So no one should be testing a person that is positive until at least 3 months later, or unless they become symptomatic again, then you retest them. But to test the person again after 10 days to 2 weeks and turn positive, the only thing you do is create a lot of anxiety on the patient, especially if you don't give them the right answer. So I'm not quite sure, why anyone would want to test them again within 10 days to 2 weeks and it turn positive and don't give them the right answer. I mean, that's not the guideline, because we know that after about 10 days to 2 weeks, you no longer infection anyone. So don't test them again, because more likely quite a few people will remain positive for up to 3 months, Sabrina. So they're not infectious. So
right. Yeah, it was 2 months. It was 2 months after, and they were tested, and they were positive.
Again, unless they have become symptomatic again, Sabrina.
Yeah.
Say that you come in and you complain of the same symptom that you have the first time you're positive. Yeah, there's a possibility that you get reinfected again. That's not the exception, because people know that you can get reinfected again, after the first one. So it doesn't mean you're immune.
Right.
So,
yeah, they went and got tested because they wanted to, go back to work. And so when it popped positive after 2 months, I guess the work required that to be a negative test result.
And
so now
that's the place where you have to convince the workplace somehow, but if they totally asymptomatic, have no symptom, I don't care. They 2 months that they test positive, they are not infectious. They don't have no more symptoms. So but again, that's why CDC don't recommend it that you retest anyone until 3 months afterward.
Right, but I mean, imagine being these people trying to get back to work and you have to take a COVID test. It's positive. I mean, what are you going to tell your boss? Like, oh no, it's not really. It's okay. I mean, we're holding up these test results as the holy word because we test people and we have so much faith in the positive and so I mean it's got to be tough for these.
That's the anxiety. Yeah, that's the anxiety part of the employer that there's certain employer that are very strict on that, and even if we quote anything on the guideline, but again, that's a responsibility and decision of the management of the employer, the workplace. But sometimes it's unreasonable for employees to expect that. But everyone workplace have to make their own decision. But as a physician, we just want to explain to the patient, and I have plenty of patients that keep turning positive, and I just reassure them, hey, you guys, you're not infecting anyone, so that's something that. But again, it's something that it had to be explained to the patient in a way that they understand, so that way they don't feel so anxious. I feel sorry for the two elderly couple that have positive and have different messages from everyone, and that's I don't know. I feel like there should be message out, and everyone should be on the same page on that one.
Doc, I wanted to follow up back on this situation at this big retail store. And really, it's just a general question for companies and businesses. If there is a positive case in their company, does the management have to inform employees that there is a positive case?
I think if we be very nice for them, for management to inform the employee, because that's how the contact tracing within the company occur, right? I mean, there's lots of company that they're on tracing now, and the advantage part about it is that you kind of isolate those people that positive and people around the close contact, so that way, in the workplace, your employee know that, hey, the upper management are taking care of them, are looking after for them, and it helped public health contact tracing. So yeah, it's nice that management will inform, down the line that they are doing their part to try to do the contact tracing and get the people in a close contact to be tested.
So it's nice, but it's not necessary. It's not required.
I don't think it's not required. Yeah, I mean, but that should be a workplace policy.
Okay.
Because this is, guys. I mean, it's you gotta look after it for your employee.
Thank you, Doc.
Any final words before we head into the weekend?
What's your advice for people this weekend?
Our advice, I tell you from the pack, is that we talked about a lot last night, and we really plead to people and everyone in Guam to, again, stay within the family unit for the next 2 weeks, and let's work together and moving forward and cut down the positivity rate. It's really helpful. If not, we're gonna go forward, but it's not nice to go forward. The hospital is full. And for another one for the people is that if you are identified positive for the COVID-19, please don't wait at home so long. If you have any difficulty breathing, you got to go to emergency room right away, and don't stay at home so long. And if you do, the chance that you survive in the hospital with supplemental oxygen and the treatment is good. So don't wait too long at home.
All right.
Thank you, Doc.
Guys.
Okay.
Right,
Do you want to confirm if it's Kmart before we let you go? I just figured I'd ask you one more time.
No, I cannot do that.
All right. Thanks, Doc.
Thanks, Doc.
Okay, guys.
Okay. See ya.